I'm Dr. Clinton Bronner. I'm a clinical exercise physiologist with Henry Ford Hospital. On behalf of my co-authors, I'm here to discuss our paper, Higher Exercise Capacity Attenuates Risk for Early Mortality Following a First Myocardial Infarction, the Henry Ford Exercise Testing Project, which will be presented in Mayo Clinic Proceedings. The Henry Ford Exercise Testing Project, or FIT project, follows nearly 70,000 patients from the metropolitan Detroit area who had an exercise stress test. We follow them for heart attack and death. In the current study, we followed nearly 2,000 patients who had their first heart attack during follow-up. We found that low exercise capacity increased the chance of dying over the first year following that first heart attack. This study is part of the Henry Ford Exercise Testing Project, or the FIT project, and it was conducted with investigators from Johns Hopkins. The primary investigator for the FIT project is Dr. Muaz Al-Mallah, a cardiologist with Henry Ford. What we found were individuals with an exercise capacity greater than 10 METs had a significantly lower risk for mortality following their first myocardial infarction at 28, 90, and 365 days. Among 70,000 patients in the FIT project, we identified over 2,000 patients who experienced their first myocardial infarction during follow-up. One of the strengths of our study is that they're a mix of men and women and of various races. There have been several prior studies that have shown the relationship between exercise capacity and risk for morbidity and mortality over a long term. We believe ours is one of the first to show that exercise capacity prior to a first myocardial infarction is associated with short-term all-cause mortality following a first myocardial infarction. While nearly 50% of the variation in exercise capacity may be due to genetics, physical activity is the only strategy that will improve exercise capacity. Our data support prior studies that show the relationship between exercise capacity, physical activity, and the risk for morbidity and mortality. In addition, it suggests that improving exercise capacity through physical activity and structured exercise training programs is important for individuals with low exercise capacity who are at increased risk for a cardiac event. Additional studies are needed to validate our findings and to identify whether low exercise capacity is associated with larger infarct size, lower ejection fraction, and other mechanical complications following the myocardial infarction.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.